My name is Dr. Nicole Tartaglia, and I am a developmental behavioral pediatrician and the director and founder of the Extraordinary Kids Clinic here at Children's Hospital, Colorado. It's really common for families to ask me when they have a prenatal diagnosis what they should be doing in the first years of life to monitor development and what they should be doing to know and find out if their child needs early intervention services. And so my recommendation first is obviously to go and follow up with your primary care provider. They will usually and hopefully are doing developmental questions and monitoring at each well child care visit. So that's your core kind of basic no-brainer answer. And then our recommendation is that they have developmental assessments along the way. Some direct developmental assessment beyond just the questionnaires, but where someone's actually looking at the development of your infant at some time between 6 to 9 to 12 months, again at about 6 or 9 months after that, so depending on when you start. So let's just say this morning I saw an infant who was 6 months old. Well, I would want him to come back at again between 12 to 15 months, and then again between 18 to 2 years, and then usually about yearly after that. And that's so that I can track and make sure development is really on target, and that some of those early, more subtle findings that you can sometimes see in terms of speech and language development and other pieces are really coming in appropriately. Now, as a developmental pediatrician, developmental pediatricians do those types of evaluations, but they can also be done by child psychologists. And then nationally, there's an early intervention program that's funded by our federal tax dollars. And so every child, in many states, every child who's at risk for developmental delay is entitled to be followed by early intervention services. And so that means that they would usually come to your house and do an evaluation and then determine if the child indeed qualifies for more regular types of interventions. So they may qualify for speech therapy or PT, or sometimes if the child doesn't have delays, they just qualify for monitoring. So they may say, okay, well then we'll come back in 6 months or in 3 months, or, and they'll qualify for monitoring for intervention. So there's kind of all of those different levels. I usually recommend make sure your PCP is there and monitoring along the way. If your state is one of those states where your child will qualify for developmental monitoring through the state services, then if that is possible, then go ahead and do that. And then also ask for referrals to a developmental pediatrician or early childhood psychologist or someone else who can do the assessments along the way to also make sure that things are coming along. Now, if there's not a developmental pediatrician, there are definitely speech therapists and physical therapists or occupational therapists who are expert in infant development. And so that's another option, is just to ask for a speech language evaluation at a year of age, a PT evaluation at a year of age, and then they can help determine if there's differences and will qualify for services.